Are you feeling constantly tired and weak? You might be suffering from iron deficiency. Iron deficiency is a common nutritional disorder that can lead to anemia if not properly addressed. But don't worry, identifying the stage of iron deficiency and addressing it through dietary changes is easier than you might think. Iron deficiency progresses in 3 stages. The first stage is depletion. During this stage, your body's iron stores are gradually decreasing, but you may not notice any symptoms. The second stage is marginal deficiency. Now you might start to feel symptoms such as fatigue, weakness, and difficulty concentrating. The third and most severe stage is iron deficiency anemia. This is characterized by low levels of hemoglobin, leading to symptoms like pale skin, shortness of breath, and increased heart rate. To identify iron deficiency, start by paying attention to common symptoms like fatigue, weakness, pale skin, shortness of breath, and difficulty concentrating. If these symptoms sound familiar, consult with a healthcare professional for a proper diagnosis. Blood tests, such as a complete blood count and iron studies, can help determine your iron status. Your healthcare provider will interpret blood test results, including levels of hemoglobin, ferritin, and serum iron, to diagnose the stage of iron deficiency. Once you've identified iron deficiency, it's time to address it with food. Incorporate foods high in heme iron found in animal products and non-heme iron found in plant-based foods. Examples include lean meats, poultry, fish, beans, lentils, tofu, fortified cereals, and dark green leafy vegetables. Enhancing iron absorption is also key. Consume vitamin C-rich foods alongside iron-rich foods to enhance absorption. Avoid consuming calcium-rich foods or supplements with iron-rich meals, as calcium can inhibit iron absorption. Cooking acidic foods like tomatoes in cast iron cookware can increase iron content. And don't forget to limit the intake of substances that can hinder iron absorption, such as tea, coffee, and calcium supplements, when consuming iron-rich meals. If advised by your healthcare professional, iron supplements may be recommended to address deficiency more rapidly. However, do remember to consult with a healthcare provider before starting any supplementation. By recognizing the stages, symptoms, and addressing iron deficiency through diet, you can effectively manage this common nutritional disorder. Remember, health is wealth, so take care of your body, and it will take care of you.